Nihon Fukushi University. Next April, a new department is scheduled to open. An explanatory meeting held in late August attracted a large number of high school students. But
we will be setting up a new nursing department, but
the university will open a nursing care department. About 150 potential applicants arrived, 3 times more than what the school had expected. This mother is currently working as a care worker and recommended her daughter become a nurse instead.
At times, I feel there are limits to being a care worker. When you hear that there aren't enough care workers, you want to help out, but I don't really want to be a care worker.
There's actually a big divergence now in the recruitment of care workers and nurses. During the past 2 decades, the number of nurse training universities has increased more than 20-fold. And according to some forecasts, an oversupply of nurses is expected by 2025. In contrast, there are only 61 universities specializing in social welfare, less than a third of the number of nurse training universities. At Nihon Fukushi University, the social welfare department is struggling to fill classes.
We go out and tell people about the attractions of nursing care work, but that alone isn't enough to reverse the trend.
Why is there such a big difference between these two fields?
20 or 30 years ago, being a nurse wasn't that popular an occupation. But a big effort was made after that, and the perception has changed significantly.
One reason behind the difference in popularity between nursing and nursing care is said to be political influence. Nurses are backed up by industry organizations that constantly negotiate for better working conditions, which have steadily improved. But in terms of wages, it's said that the gap between the two professions isn't as big as commonly thought. According to one survey, the annual salary for a nurse and a nursing care worker who've stayed at a single facility for 15 years is about the same, at around $42,000. Given this, the Health, Labor, and Welfare Ministry believes the decline in the popularity of nursing care has been excessive.
The perception of the nursing care industry has suffered as a result of various scandals caused by private operators who entered the field. We offer our sincere apologies.
The Compson case that occurred between 2006 and 2007. Compson, which was the biggest home nursing care provider at the time, had been found to be carrying out illegal billing practices. The scandal is said to have delivered a big hit to the industry's image. In Aikawamachi, Kanagawa Prefecture, one facility is working to overturn that negative image. Takuya Baba heads the Management Strategy Office. What are they doing to accomplish that mission? Mr. Baba points to a T-shirt that's part of the uniform here. He says they started with the clothes that workers wear.
Many people say our uniform is cute, that the logo is cute.
In fact, Mr. Baba used to be a top salesman at Italian fashion brand Giorgio Armani. 4 years ago, he started working at a care facility run by his parents to transform the image of the industry.
Senior citizens' homes weren't seen as very open. I felt we had to gradually pry open the doors.
About 100 people work here. One of those is 19-year-old Tetsuya Kataoka. He too didn't have a good impression of the nursing care field.
My only impression was that it was dirty work, that you had to clean up after people.
After graduating high school, Mr. Kataoka began working at a certain facility, but with conditions much worse than he originally imagined, he quit after a month. In contrast, this facility has a performance-based wage system with managerial-level employees earning an annual salary of $60,000 or more. In the morning, he mainly helps residents take baths. He talks with them as he does this.
He's very conscientious and works hard.
What does Mr. Kataoka think of nursing care work now?
It's completely different from what I imagined nursing care work to be. I want to continue doing my best here.
Mr. Baba believes that improving the image of nursing care is an issue that goes beyond this facility.
The question is how to reach out to people working in nursing care and those wanting to enter the field. It's something that the entire industry has to think about.